Question number one is, where are you from and have you always lived in Texas? My childhood was in Canada, and so that's where I mostly grew up, but my family and I, we moved to the Houston area where I did high school, and that's where I stayed to also do college and medical school. After medical school, I went up to the Seattle area in order to finish up my training, and then I moved back to Texas to start practicing as a family medicine doctor. Question number two is, tell me about your education. So after high school, I went to college at Houston Baptist University and I got my Bachelor of Science in French and Biology. So I was fortunate enough to double major, which was a lot of fun. After college, I went to medical school at Baylor College of Medicine, and that was for 4 years. And after that, I went up to the Seattle area for my family medicine residency. And I went to Valley Medical Center, which was a University of Washington affiliate. And I was there for about 3 years. Next question is, why did you decide to become a doctor? Becoming a doctor was something that I thought about for quite a while. I grew up with chronic illness in the family, so from childhood I was able to see what chronic illness can do to not only the patient but the family that's involved. There were a lot of times that we were in and out of doctor's offices, oftentimes in and out of hospitals, and I really saw firsthand what it was like to be a patient, but also what it was like to be a patient's family member. It's one of the prime reasons I'm in family medicine. I like to treat the patient, and I also like to get to know families really well. I think getting to know everybody as a whole is actually a benefit. What is your treatment philosophy? Well, my treatment philosophy is fairly simple. I feel like my role as a primary care physician or as a family physician is to tell my patients what their options are for evaluation and for treatment, and what are the risks if you don't do the evaluation or treatment. Ultimately, I want to give that choice to my patients. It is up to them as to what they want to be done for their body and their health. It's not up to me to do that. Now, if a patient wants me to make those choices for them, I will definitely let them know my opinion and kind of the way I would go if I were in their situation. But my role as a family medicine doctor is to really be my patient's partner or team member when talking about their health and their options. The other thing is, in general, I will treat all my patients as if they are my family. I will do my best to take care of them and to treat them with respect and dignity. And I think that that's one of the most important things we can do as a primary care physician. Another thing that I really like to concentrate on is lifestyle management. There's a lot of things we can do in our lifestyle to be able to help prevent and treat disease. And that comes with nutrition changes, hydration, stress management, good sleeping habits, sunlight exposure, and socialization. Those are all very important things, and it's something I work with my patients on when we talk about treating illness and preventing illness. Now, obviously, lifestyle management is not right for everyone. Not everyone can do everything right at the same time. So we do have options for medication management, surgical management, help from specialists. All of those things are available, and it's something that we should use in order to help decrease the risk of chronic illness and chronic disability. But again, ultimately, it's the patient's choice. My role is to tell my patients their options, and their role is to decide what's best for them and their body. The next question is, do you believe in alternative medicine? So I don't like the term alternative medicine. I prefer the term complementary medicine. And that's because I really don't feel like there is a complete alternative to traditional allopathic medicine. The truth is that there is very serious disease out there, and if you're not looking for it, you're not going to find it. And unfortunately, with complementary medicine type of treatments or evaluations, they simply are not looking for, or they just don't know to look for, for the things that are serious and either life-threatening or life-changing. So I like to talk about complementary medicine, and I do truly believe that there is complementary medicine out there that we do not use enough. Acupuncture, breath and breathing techniques, chiropractic treatment, reflexology, aromatherapy, massage therapy, ancient Chinese practices, cryotherapy, physical therapy, occupational therapy. I don't put those in the complementary medicine type of fields. I put that more in the allopathic medicine fields, but some people would put it in the complementary medicine fields. Bibliotherapy. Bibliotherapy is something that I love, and that is what it means is learning from reading books. So I do think that there is healing in reading books or even listening to books or listening to podcasts. I think we can learn a lot doing that as well. And I just want to give you a couple of stories of why I feel that way, that it should be complementary medicine versus alternative medicine. Alternative medicine means it can replace allopathic medicine. And the reason I highly encourage you not to do that ever is because as allopathic doctors, we are trained to look for things that are serious, life-threatening, and life-altering. Unfortunately, a lot of the complementary medicine modalities, they are not trained to look for those things or to even think about those things. I'll give you a couple of examples of that. You know, I had a patient who came to me after she was in desperate states. It started with back pain. So she had some lower back pain. It was really bothering her. She saw a different doctor, her primary care doctor at the time, who, recommended certain things to help with it, and eventually did some imaging, and there was a spot seen in the bone. The spot was really small. It didn't look like anything concerning, but always with that type of thing, there's sometimes a recommendation of, hey, we should look at that spot again in 3 to 6 months with some more imaging. And so unfortunately, the patient got frustrated because in those 3 to 6 months, her back pain just got worse. And so she didn't go see her primary care doctor because she didn't feel like the primary care doctor helped at that one visit when she went to see her primary care doctor. So instead, she went to seek chiropractic care. And the chiropractic doctor did his chiropractic evaluation and treatment, and she continued those treatments for about 9 months before she gave up on those treatments because, again, her back pain was just getting worse. Now, by this time, it's been about 9 to 10 months, and because things were not getting better, she went back to her primary care doctor at the time. And he did some imaging again, and unfortunately that tiny little spot in the bone had grown to almost an orange size or a grapefruit size mass, and that was obviously very concerning. Instead of a small procedure that could have been done when the mass was small, the patient had to get a very large procedure, and it involved amputation. And obviously that is life-changing and life-altering. The moral of the story is that, the chiropractic specialist didn't have it on his radar. He didn't know to think or look for something like that because it's just not part of his training. So that's one example, one story. A good example of that would be a patient who was having really severe abdominal pain. It was crampy abdominal pain. It was kind of all over. It would come and go, but when it did come, it was severe. And the patient does not like going to see doctors, does not like traditional medicine, and so instead she saw a naturopath who did a naturopathic evaluation, recommended a whole slew of supplements and vitamins, which the patient diligently took. And unfortunately, the patient didn't get better. And after a few months, she sought traditional care, or traditional allopathic care, instead of complementary medicine. And when she did come to see me, as a new patient, I was able to start the evaluation, and unfortunately, she had a diagnosis of inflammatory bowel disease. And that was something pretty evident with some basic labs. So I was able to get her set up with a gastroenterologist and get the appropriate studies. Unfortunately, the disease had already created some scarring in her intestines, and she required surgery to remove that scarring. And again, something that is life-altering, life-changing, probably something that could have been avoided if she was able to seek typical Western medicine allopathic care. So those are just a couple of examples of why I always recommend see an allopathic doctor first, or in addition to your complementary medicine practitioners. Just make sure that there's not something major going on, not something life-altering or life-changing that's going on. The next question is, how long have you been a doctor? And I can't believe that I am saying this, but I have been a doctor for over 20 years now. It has been a privilege, and it has been very challenging, but I can say that I love what I do. I do really love my job, and I love helping patients and seeing them through sometimes the most vulnerable parts and times of their life. I do find it a privilege to do that. So the next question is, what is the hardest part of your job? That's a hard question. I will say that probably the hardest part of my job is being okay with decisions that patients make for themselves that I may personally think is not the right choice. Sometimes that's really difficult for me. I can see certain conditions as an easy thing to treat. It's not that hard. And it's something that we can definitely get better, but patients have their autonomy, and they have the right to choose what they want done for themselves and their body. And sometimes I may not agree with that choice, and that can be really hard for me sometimes, because I do want the best for my patients, but sometimes what I think is best for my patients is not always what they think is best for themselves. So I would say that that is probably the hardest part of my job. The next hardest thing is something that I'm sure you can predict, and that is work with or deal with the people who get in between the doctor and the patient relationship. In my opinion, medicine should be very simple. It should be between the doctor and the patient. There should be nothing in between that interferes with that relationship. Unfortunately, we have a lot of things these days that are interfering, and those things can be anything or everything that you think of or I think of. Insurance companies. We all know how much they interfere, and they're there for a reason, but gosh, they have made my job very difficult, and they've made patients' lives very difficult, and it really doesn't need to be this hard. The government is definitely getting between the patient and doctor relationship. They have their own rules, and there's nothing wrong with rules, but sometimes rules don't make sense and changes need to happen. But they have their rules, and we've got to follow them. We can all think about pharmaceutical industries or the pharmaceutical industry. They definitely get in between the patient and the doctor because they oftentimes will make outrageous prices for their product. And when you have a life-saving or life-changing product for a patient, you will do anything you can to get that for your patient. But again, it shouldn't be that hard. So I would say that that is the hardest part of my job, is dealing with the bureaucracy and the madness that comes between the doctor and patient relationship. What do you like most about your job? Well, what I really like about my job is getting to know my patients and getting to know their families. I really do enjoy that a lot, and I hope they know that they can trust me and that I am part of their team, and I really do want to be there for them as much as they need me. I truly care about my patients. That's all I can say. Next question is, why did you decide to start a direct primary care practice? So direct primary care is a different model than the typical insurance model that we all know and hate. So the reason that I started a direct primary care practice is so that we can get back to a time where there is nothing that interferes between the doctor and patient relationship. I don't want there to be a lot of interference in between. So with a direct primary care model, it is all about patient's choice. It is about seeing patients on time. It's about being available even after hours for urgent matters. And it's about having time to discuss medical issues, medical problems, and time to explain exactly what is going on with your body and what to expect. And then also what your choices are and what are the risks and benefits of those choices. All of that takes time, and unfortunately in our typical insurance model, I'm sure you have felt this before, but there is no time. When you schedule patients every 15 minutes to do everything, there's not going to be a lot of time with your doctor. And time is the most precious thing with your doctor. The next most precious thing is access to your doctor. And those are the reasons that I started a direct primary care clinic, is because I want that back for myself, but I also want that back for my patients. So this is my small way of trying to shake up the system a bit, because we need something different than what we already have. What do you like to do when you are not in your doctor role? Well, when I am not in my doctor role, I love to be outside and be in nature. One of my favorite things to do is to hike. Unfortunately, here in the Dallas area, it's a little bit tough. There's not a lot of elevation, and the weather can be brutal, especially during the summer. So I don't get to do that a whole lot here, but when I do plan vacation, that's usually on the top of my list. I also love spending time with friends and family and my dog, and those are the simple things that make me happy. Other things are reading. I do love to read, and I do love my book club, so shout out to book club. I do enjoy writing as well. I do find writing therapeutic. And I love my quiet time to simply sit and either be bored or to let my mind be creative. And every now and then I'll pull out some paintbrushes or do a craft or do a puzzle or do some diamond art. I love all of those things because it uses a whole different part of my brain. Well, I hope you got to learn a little bit more about me, and I hope that I have answered some of the questions that you had in your head. If there's anything else that you are dying to know, please feel free to reach out to me. I'm Dr. Kainth with Maple Primary Care. You can follow me on YouTube at Healthcare Hints with Dr. K. You can also look for me on Facebook. Bye.